The management process is intense, and part of that is because it has to be individualized.
I think it's important as symptoms progress and move forward and hopefully improve quickly to keep an eye on specific symptoms and what makes those symptoms worse. So much of concussion recovery is subjective and based on how someone feels rather than hardcore objective data.
It's really up to each individual healthcare provider how often you reassess your patient during the recovery process.
90% of these kids will get better within 2 or 3 weeks. 10% wind up taking a little bit longer.
Some research here done in the state of Nebraska indicated high school athletes with their first concussion often recover in about 7 days. But there was considerable individual variability ranging sometimes from 3 days to 15 days or longer, particularly if it wasn't their first concussion.
If somebody's having more symptoms or more complex symptoms, I tend to see them more frequently. If things are stable and improving, then I'll often spread those visits out.
Some people prefer to see them fairly frequently, particularly, for example, like a certified athletic trainer in the school setting may see them daily to assess their recovery pattern, versus a physician who is outside the school system or working in another environment may see them every week or two, depending on the recovery process.
The management process is a team approach.
So when you're reassessing a patient in follow-up, it's important to get feedback from the school, the parent, and the athlete himself.
The licensed healthcare professional is going to be the individual that sees the patient initially and sets the course and sets the direction for the management of the injury. But it really is going to be those other team members that may be responsible for the daily interactions with the patient, helping them determine what behaviors cause symptoms, what behaviors help reduce the symptoms, and then providing that feedback to the patient and also to the licensed healthcare professional.
It's very important for you as the provider to maintain contact with those who are following that recovery process to assure that the individual has sufficient time to recover before their return to high-risk activities.
But it's going to be specifically up to the licensed healthcare professional to know their patient, to understand how age plays a factor in the recovery process, and understand the activities that individual is going to be engaged in that may impact their recovery.